Joining us now on our COVID-19 Niagara update, we have Dr. Mustafa Hirji. Dr. Hirji is the Medical Officer of Health for Niagara. We try to check in with him. So going over the numbers, 47 cases is what was reported this morning, and 4 deaths to this point. A little bit of discrepancy though, because Niagara Health is saying they are currently treating 67 patients for COVID-19. Why is there a difference between those two numbers?
No, that's a really interesting question, and it's something we've been having a lot of conversation with them. And so there's a couple reasons behind this. First is Niagara Health knows about people tested in their hospital. That's their source of information. For us in public health, we get our information through reports from labs about Niagara residents. So if, for example, someone has been tested in West Lincoln or tested in primary care, Niagara Health doesn't know about it, but they would show up in our results. Likewise, if someone who's, say, a Hamilton resident or maybe someone from New York State happens to show up in the hospital and is tested for COVID-19, they will show up in Niagara Health numbers, but not in public health numbers. So unfortunately, I think some of that is going to lead to discrepancies between what Niagara Health reports versus what we report.
The numbers right now, we look at 47 today. Only 10 days ago, that number was as low as 4, officially reported by public health. Why that rapid increase, and is that surprising to you at all?
It's not surprising to me per se. I think we've seen similarly this has happened in other regions, really across the entire world, as when cases start to present, they have a little bit of a snowball effect. When we look at the cases, we are seeing that the majority still do seem to be travel-related. And, of course, March break recently ended, so we are getting people who are returning from March break and travel from that. And the spillover of growing case counts elsewhere in the world is showing up as them becoming cases as well. The other part, though, is we have started to see local transmission of the virus here. And, of course, if the virus is starting to transmit locally, one infection leads to probably 2 to 3 other people getting infected. Those people lead to 2 or 3 others. And so there's a little bit of a snowball effect from that as well. And so I think this is why it's really important to be following that advice that our provincial governments have been giving us around physical distancing, washing our hands, limiting our time outside.
Is it your opinion that we haven't reached our peak yet with that number of 47?
We have definitely not reached our peak yet. It is going to be, I think, several weeks, if not months, before we, stop seeing new cases. I think as well the daily case count is probably going to increase for about the next couple of weeks, maybe a little less than that. But hopefully in the next couple of weeks, we will actually hit a peak of the number of new cases in any day, and that number daily will start to come down a little bit.
Does that make it riskier than for your average citizen to make that trip to the post office, make that trip to the grocery store to restock?
There's a little bit more risk to that, absolutely. I do want to emphasize that for most people, COVID-19 is a relatively mild infection. Over 80% of people don't need any specific medical care. They can stay at home and recover on their own. The real risk, though, is that you may have a very mild infection, or you might be just about to develop symptoms and still be transmitting that virus. And so you could be infecting the people you go interact with when you're outside. And that's really why we're emphasizing this requirement that people minimize their trips outside. Obviously go do the things that you need to do, but otherwise try and avoid interaction with people beyond your immediate household, so you're not transmitting that virus, so we can break that chain of infection and we can see those daily case counts come down again.
Are people taking it seriously of all ages? I think a lot of people are of the opinion that younger people are not taking the social distancing recommendations seriously.
I don't want to, make any broad brushes about certain age groups are following it more than others. I, certainly hear anecdotal stories from all kinds of different age groups of some people not taking it seriously, as well as stories of some people taking it very seriously. Everybody needs to just be mindful that we're all in this together. This is a population-wide phenomenon that we're dealing with, and we all across the entire society have to pull together, do our civic duty to break this chain of infection by limiting our interaction with others, staying home as much as possible, really being diligent about things like hand hygiene. And if we do develop symptoms, not to ignore those symptoms. Make sure to, call your healthcare provider.
The situation that everyone is following up in Bobcaygeon is very grim with the retirement home, 13 deaths amongst the residents. What can be done to help retirement homes get through this?
When you have a retirement home or a long-term care home affected, it's almost the worst case scenario because you have a large number of people, first of all, living together in relatively close quarters. And those are elderly people, often people with medical conditions already. And they're the group who are going to fall in that 20% who are going to have more severe illness and need to be often hospitalized. Some of the things that we're doing in Niagara Region Public Health is that we weekly go out and visit these locations to check on what their infection control measures are, advise them on how to make sure that they can minimize the risk of infection coming into their homes. So that's an important step we're taking. When we do get these outbreaks, we're working closely with them to break that chain of infection so we limit the amount of spread of infection we're having there. Again, though, these are people's homes. They're going to have visitors. They're going to have, loved ones who want to come visit them. And I think it's really important that if right now, when we're seeing the virus circulating, if we can maybe minimize some of those visits a little more, do them over the phone, really try and limit the opportunities for that infection to be introduced into these homes, that's something that we can all do at this time.
Thank you very much for that advice, and thank you for your time, Dr. Hirji. Appreciate it.
You're very welcome.
It's Dr. Mustafa Hirji, Niagara's Medical Officer of Health. We'll be back with more in a moment.